Hello everybody, my name is Jordan Mast. I am a PA at the Colorado Neurological Clinic. This video is really to focus on the importance of diagnosing Alzheimer's disease very early, and what does that actually mean? Because really an important point to make is in the last few years, our access to diagnostic tests have exploded. Really prior to the introduction of the new amyloid targeting therapies, we really unfortunately had to guess when we thought the patient might have Alzheimer's disease. If you had a dementia patient sitting in front of you, about 50 to 80% of the time it was probably Alzheimer's disease, just statistically speaking, and you would do testing to rule out other causes and then fall back on this diagnosis of Alzheimer's disease. However, things have changed pretty significantly in the last few years. Certainly that initial visit, we spend time taking a good adequate history, checking a physical exam. This is things that we all do in clinical practice, a more neurospecific exam in my practice. And then we might do some cognitive testing, though in our practice we actually do a cognitive assessment screen at a subsequent visit just for time's sake. That might be maybe a MoCA. CDR is a clinical dementia rating scale. We don't typically do that unless we're required to by insurance, just because it takes too long, but can be a very interesting additional added benefit. We actually will do a computerized test that we have on hand on an iPad, and that allows the patients to do a very easy cognitive assessment screen. And the benefit of this is it allows us to measure it over time. You'll see a lot of people talk about neuropsych testing. Really the biggest issue with neuropsych testing is that it takes too long to get those tests completed, and it's just not viable for a lot of situations. If you're in an academic setting or something, great, and it can be very, very good data, but I don't like it to be a rate limiting step for patients. Beyond some of the more standard tests that you would do, talking to the patient, getting that history, we also want to really focus on what is their mood like. Do they have depression? Do they have anxiety? Looking into things like obstructive sleep apnea, evaluating for possibilities of secondary causes of cognitive impairment, like laboratory testing, things like thyroid disease, vitamin D deficiency, B12 deficiency, syphilis. These are things that are typically handled in the primary care setting, but we oftentimes also double check to make sure they were done, because those are very, very treatable problems. However, once we get to our more advanced testing, we talk to our patients about neuroimaging. Again, when I use the whiteboard, what I like to do is I like to draw 1, 2, and 3, talk about neuroimaging. An MRI of the brain, for instance, is an incredibly important part of evaluating not only secondary causes of cognitive impairment, such as vascular type dementia or normal pressure hydrocephalus, but it also just gives us a general idea of brain health. I always tell patients, an MRI is not going to be diagnostic for Alzheimer's disease. It just gives us an idea of how the brain is looking. And then we oftentimes will also do an electroencephalogram. An electroencephalogram gives us a little bit of an idea of brain function. Is it slow? Is it disorganized? Is there any epileptiform features? But beyond that is really what is getting more exciting in the last few years, which is the amyloid specific testing, this Alzheimer's disease specific testing. In the past, it was mostly centered around research. We would do amyloid PET scans, which were very hard to get, lumbar punctures, which were hard to get and very uncomfortable for the patient. But nowadays, these tests are oftentimes covered by insurance and really required if we want to specifically focus on getting those amyloid targeting therapies in place. But beyond that, we now are starting to utilize the blood-based biomarkers, and the blood-based biomarkers are really, really where I think the future is going to be for testing. There's currently only one FDA-cleared blood-based biomarker, but it's getting more and more accessible. In our practice, the blood-based biomarkers are simple tests that we run through LabCorp or Quest Diagnostics, whatever's easily available, and it's a screen. We will also do ApoE4. ApoE4 is a genetic marker. It has implications not only in their potential to develop Alzheimer's disease, but it also has implications on the risk, which we'll get into future videos. So that's where we really focus that first visit in explaining to patients what the next steps look like. And then the next video, we're going to be discussing treatment, so stay tuned.